Good morning. Today I want to talk about how electrical stimulation can be beneficial for patients with Bell's palsy. What is Bell's palsy? Bell's palsy is a disorder that causes temporary weakness or paralysis of the muscles on one side of their face. It typically sets in quickly in just hours or days and can appear similar to a stroke. The exact cause is idiopathic, but it is generally thought to be caused by an inflammation and swelling of the facial nerve. Many patients with Bell's palsy, however, have recently experienced a viral infection. The condition is usually temporary, and most patients even tend to see an improvement within those first couple of weeks, and some even can see a full recovery within 6 months. And here is just a visual on how one would present with Bell's palsy. Some treatment and recovery options. For some cases, it is possible to fully recover without any intervention. However, treatment is available to speed up recovery and increase their chances of a full return to function. The primary goals of treatment are to reduce inflammation, prevent damage to the facial nerve, and protect their eye. Oral prescriptions are a common first step in treating Bell's palsy. We have corticosteroids, which could be taken to reduce the swelling around the facial nerve. Antivirals can also be prescribed since Bell's palsy is often linked to that viral infection. And then we have physical therapy. And physical therapy can provide facial exercises, which could be very beneficial after the acute phase for more individuals with more severe and long lasting case. Physical therapy can also provide patients with exercises and gentle massage techniques to maintain muscle tone and prevent atrophy of the paralyzed muscle. Electrical stimulation as an intervention. The primary concern around Bell's palsy is synkinesis. And synkinesis is a common complication of Bell's palsy, and that is where the facial nerve fibers will regrow incorrectly, causing involuntary or abnormal movements in the facial nerves. The consensus from many systematic reviews is that electrical stimulation is not recommended in the acute phase, which is typically within those first couple of weeks. It is highly recommended that a patient seek medical consultation within the first 72 hours. Research has shown that electrical stimulation may provide benefit, particularly to patients with a more severe or long-lasting symptom. Recent study indicate that electrical stimulation can also help to accelerate recovery without increasing the risk of synkinesis. Next, I want to talk about providing electrical stimulation treatment. Research has trended towards a guideline of pulsed monophasic stimulation with a frequency of around 20 hertz for around 20 minutes a day. In a clinical setting, NMES is a preferred method to directly stimulate the muscles or the motor points of the nerve. Since the motor points of the nerve have a lower activation threshold than a muscle, or we would use the TENS unit, which we typically use for pain, and that can also be used. Now we'll talk about e-stim modalities and their parameters, and we'll talk about the TENS unit. Researchers studied the sensory threshold and tolerability limit of constant pulse current applied to the face, which adjusts between 5 to 15 milliamps, is often safe to use. And here we just have a chart. We're showing the lower rate and then where patients tolerated. Here, we'll talk about the benefits of using a TENS unit is that it is low cost and patients can purchase and perform the intervention at home and on their own time, and they don't have to come to the clinic as often, which is kind of nice for them as well. Next, I want to talk about the study that I picked, and it is called The Effect of Transcutaneous Electrical Nerve Stimulation and Faradic Current Stimulation on the Recovery of Bell's Palsy. And this study examined the benefits of using a TENS unit and the faradic current stimulation on the recovery of Bell's palsy. And they used 196 patients and they divided them into four groups. The first group had conventional therapy, the second group had the TENS unit, the third group had sporadic current stimulation, and the fourth group had both. Patients were assessed 2 weeks after their symptoms and after 1 month. And at the end of the study, they ended up using the House-Brockman scale. And the House-Brockman scale is really just to see the severity of their symptoms of Bell's palsy. And it's graded from 1 through 6. And here is a more visual on how one would present and how they would grade them. In this table, it shows that the number of patients at each severity level are roughly equal across all four groups. So each treatment method has equal opportunity to present if its effectiveness is impacted by the severity level. Next, we can take a look at the summary of improvement of each group. This is simplified down to just the mean House-Brockman scale for each group for each evaluation point. We can see that the electron score, which means the severity of their symptoms, compared to the standard treatment group. The TENS unit group is particularly shows the best rate of improvement. Finally, we can look at the same information, but in a graph form. Here you can see how quickly the score decreases in group B than the others. A similar research, the outcome of the study is similar to the findings of another study, efficacy of adding selective electrical muscle stimulation to usual physical therapy for Bell's palsy, which found selective e-stim accelerated recovery of Bell's palsy patients, cutting improvement time in half. Thank you. Have a good rest of your day.